This is Caring for Kids on News Talk 760 WJR. Presented by the Children's Foundation. And here's your host, President and CEO of the Children's Foundation, Larry Burns.
Thanks, Mark, and hello, everyone, and welcome to the May episode of Caring for Kids. I hope that each of you listening are healthy and safe. And as you may know, mental health and wellness is a key focus area for the Children's Foundation. And in honor of May being the Mental Health Awareness Month, our show tonight features previously recorded interviews with three of our past guests who are all making a significant impact on the mental wellness of children and their families. On tonight's show, we'll have Dr. Robert Schoener, Superintendent of the Rochester Community School District. Shenandoah Chefalo, mental health advocate, author of the book Garbage Bag Suitcase, and faculty member at Center for Trauma Resilient Communities. And lastly, Dr. Elizabeth Kaufman, the program director for the Trails program at the University of Michigan. It's all coming up next on Caring for Kids, here on the great voice of the Great Lakes, News Talk 760 WJR.
Welcome back to Caring for Kids on WJR. Presented by the Children's Foundation. Once again, here's Larry Burns.
Dr. Robert Schoener grew up in Sterling Heights and is a graduate of Sterling Heights High School. Upon receiving his teaching certificate and bachelor degrees from the University of Detroit, he was commissioned as a second lieutenant in the United States Marine Corps. Dr. Schoener later earned a master's degree from Central Michigan University, my alma mater, an educational specialist degree in administration from Wayne State University, and a PhD in educational leadership from Oakland University. He has them all covered. Not long after that, Dr. Schoener became the principal of his alma mater, Sterling Heights High School. Today, Dr. Schoener serves as the superintendent for the Rochester Community School District, where he provides executive leadership for 13 elementary schools, 4 middle schools, 3 comprehensive high schools, and the Caring Steps Child Care Center. That's a lot. So, Dr. Schoener, welcome to Caring for Kids.
Thank you, Larry. It's a pleasure to be here.
Yes, it's great to see you, and looking forward to seeing you at our summit and some of our other events. So, thought it was important to get a leader of your stature in a community like Rochester to talk about some of the things that are going on in your schools, so that hopefully we can help some people and direct them in ways that maybe they wonder. So first of all, I want to start out telling us a little bit about the school system, Rochester. I mentioned the schools and the numbers, but tell us a little bit about the school district.
Sure. So we are Rochester Community Schools, and people may not realize it, but we're about 66 square miles. It's a large system, almost 15,000 kids, and we serve kids from 0 through 26 years old, including adult special education students. We have a wide range of services. I'm blessed to work with a staff of people. It includes amazing teachers, administrators, social workers, psychologists, just an entire community that's committed to their children.
And one of the things I was wondering is, because just the other day I was reading the Grosse Pointe, I live in Grosse Pointe, I was reading the Grosse Pointe News, and there was an article about having to maybe close some elementary schools. And so that obviously would tell me that maybe there's not as many kids. Is that also the type of trend in Rochester, or haven't you seen that?
Well, we pay really, really close attention to enrollment trends as Michigan's per pupil funding system. One of the things that we found in Rochester, though, is we're growing slightly, and I think part of that, if you talk to our municipal leaders, they'll tell you that that's because of the value of the public education system and the value that people place on our system. So I think Michigan as a whole, we're losing enrollment, and that's due to our birth rate.
Right.
We're lucky enough in Rochester to be slightly growing.
Oh, well, that's good. That's great news. So, as you well know, and hopefully our listeners who listen every month know, that the foundation has a focus on mental health, one of our 5 focus areas. And in one of the reasons I really wanted to have you on the show is to talk about your schools, from grade school, maybe middle schools, and certainly high school. Are you seeing more mental health, behavioral health issues with students?
Well, we certainly are,
Okay.
and some of them are severe.
Right.
We have been not immune to tragedy. We've experienced suicides, including middle school and high school, and we've certainly had some mental health crisis. We have had students that we've lost to addiction. Even their addiction probably started when they were with us, and they passed away after their graduation, but nonetheless, they're a member of our community, and we have seen an increase in depression, anxiety, addiction, and suicidal ideation. So it is a crisis.
Well, that is the main reason. It's a focus area of ours at the foundation. And you sort of alluded to a little bit of some of the trends, but are you seeing trends that maybe that can lead all of us to helping this crisis? Meaning, is it social media? Is it early experimentation with drugs? And what trends, if any, are you seeing?
I think the cause remains to be seen. We anecdotally like to say it's social media or maybe what's going on in the greater media in terms of movies and entertainment. But I think it's just it probably has factors that are based in all of those things. The positive thing that I see, particularly in our community, is of people that love their children and want to do the very best by them, and the community does. I think the challenge that we all have is removing the stigma and trying to figure out how to collaborate together in a way that's efficient and productive, so we can reach the most amount of kids.
Yes, and I also have come to learn that superintendents like yourself and districts are trying to educate teachers a bit more on how to handle behavioral issues in the classroom, because they really weren't always trained to do that.
Correct, and we're very fortunate. Again, I have a team of behavioralists, including psychologists, social workers, and counselors that work, learning consultants that work together with our teachers to help them with that behavior management. And we're actually even taking it a step farther now. We're working with our PTA to work on things like mindfulness and teaching kids how to be present and how to handle their stress and their anxiety before it becomes a problem. The other thing that we're working on really hard is to remove the stigma and make sure that kids know they can ask for help when they need it.
And we're talking with Dr. Robert Schoener, Superintendent of the Rochester Community School District. And on that point, we're now partnering with Michigan State University, and the recent meeting that you were involved in that was in Crane's Detroit Business, there was some people from Michigan State. And what they're telling us is that the generation of college kids now, I guess they're Generation Z, are much more able to talk about their behavioral or stress issues than maybe my generation. And so are you seeing that in high school or even in middle school, that if I have an issue, am I more willing to keep it to myself, or do you see more kids talking about what's going on in their lives?
I do see more openness about it. I still think there's a stigma, particularly with addiction, that I'm not sure it's the kid's problem. I might be an adult problem, and that's something that we're working really hard to get through and to get to the positive end of that. When I think about the future, I don't despair. When I look at our students in school and I visit schools, I have a tremendous amount of hope because of what you just talked about.
Right.
I see a lot of love amongst them. I see a lot of cooperation. The challenge that I see is we adults have to figure out how to channel that and get them in the right place if they do need intervention.
Right.
And that's something that we're working diligently to make sure that we can accomplish.
That leads me to a question I wanted to ask that I think could be very helpful to our listeners, particularly grandparents and parents, that as a Marine, as a superintendent, as a former principal, what if a parent thinks their child in any grade level is having issues? Do you have any advice to give them that you might have learned over the years that could be helpful?
Yeah, I think the most important thing is, when a child is showing signs of struggling, or that they say they are struggling, that we don't panic. That we assure them that things are going to be okay, then we get them some intervention. And I think we also have to rely on our community, on the resources in our community. I can tell you that if someone calls our counselors, our social workers, their kids' principal, their kids' teachers, they're gonna act quickly to make sure that there's intervention for that child. The thing that we see as a challenge is people asking for that or identifying it.
Right.
And again, I don't know that it's it might be more of an adult problem than it is a child problem. And we've got to be making sure that we're really, really observing what's going on. And if we see something that needs intervention, let's go ahead and do it and not act like it's an event. Let's act like it's just like it is. It's just something we do on a daily basis to make sure that the well-being of our kids are taken care of.
Well, and treat it more like a disease than maybe in the past the stigma has produced.
Yeah, I think so. I think if we really believe that it's a disease and we believe that it's not a condition of poor judgment, that we need to put our money where our mouth is and act like that, and not cast a stigma upon it, but reach out a helping hand. One of the things that we've done in Rochester, we just recently put together a social emotional task force, and what I've asked that task force to do is to go out and find the best mental health, comprehensive K-12 mental health benchmark they can find in the nation, and then we'll bring it back to our organization and try to replicate it.
Right. So taking the initiative to be proactive and helping kids.
Yeah, I think it needs to be more of a routine, just like we would, if we had a child with a literacy issue, we would offer intervention, and we've got to just make sure as a community that we're addressing it like that.
Sure. And so I mentioned earlier on that the foundation has a focus area of mental health, and I spend a lot of time talking to leaders like yourself. And so one of the questions I wanted to ask is, what can our foundation do more of to help superintendents, teachers, parents in this behavioral health crisis?
Well, one of the things that you've done for us already, and I think that you're doing a tremendous public service for the entire listening area, Southeast Michigan, is to raise awareness and then to encourage collaboration. Even when I was able to participate with the event that you described earlier, it was an opportunity for me to meet people that I've already connected with and been able to bring those resources to our school district. So I think that networking is incredibly important. I think the communication and the removing of the stigma and talking about it as much as we can is critically important as well.
And I think I had a meeting with my chairman today, Matt Friedman, and I think because of that meeting that we had, you met the Daniels family.
We did.
And didn't Ken recently talk in Rochester?
We did. We have a Chamber of Commerce event every year. It's called a Community Outlook Breakfast, and usually at the press conference, it's usually good news, right? We usually announce that we're opening a building or a program, right? I really thought long and hard about it this year, and we decided that we were going to announce our social emotional task force, the launching of it at that event, and we're able to contact Ken Daniels, and he was able to help us make that announcement. And if you haven't heard Ken Daniels' story, it's gut-wrenching,
right?
It's so moving. We so much appreciate his courage to come out and help us to launch that event.
Yeah, well, thank you. And that makes me feel really good because the Jaime Daniels Foundation, Ken's son Jaime, who died of an opioid overdose, is a component of our foundation. And we're helping Ken raise awareness, raise money, and eventually he wants to have the Jaime Daniels Long-Term Recovery Center somewhere in southeastern Michigan. And so those connections tell me that connecting people can really do some good work. So anything you want to add about what's going on in the Rochester school system?
Well, I would like to say it's graduation season and prom and a lot of exciting stuff happening and kids transitioning, but it's also an opportunity for us adults to make sure they're making sure our kids are making good and safe choices and avoiding things like drugs and alcohol in a way that can be damaging.
Absolutely. Well, thank you for all you're doing. You're doing a great job.
Thank you.
We're so fortunate to have you involved in our different activities. That was Dr. Robert Schoener, Superintendent of Rochester Community School District, here on News Talk 760 WJR.
Welcome back to Caring for Kids on WJR. Presented by the Children's Foundation. Once again, here's Larry Burns.
We have Shenandoah Chefalo on the line, and plagued and embarrassed by her name, Shenandoah Chefalo developed a tough skin at an early age. Along the way, she learned to deal with disappointment, how to push through discomfort, overcome adversity, and accurately gauge people, qualities that have certainly helped her to succeed. After spending nearly 20 years as a law office administrator, Shenandoah became unsettled by the ever-revolving door of the criminal justice system and set out to find a way to change it. Shenandoah Chefalo is a graduate of Michigan State University, go Green, a core essential graduate from Coach U, and faculty at the Center for Trauma Resilient Communities. So, Shenandoah, welcome to Caring for Kids.
Thanks for having me on today, Larry.
Our efforts in behavioral health, mental health are now a major focus area of our foundation, and it's also a statewide effort. So we hope to be more engaged in your neck of the woods in the near future. So I just wanted you to know that.
Well, we always welcome people to northern Michigan.
Great. It's beautiful. So tell our listeners about your early childhood and how these experiences shaped your future. And I know they're very interested in hearing that story.
Yeah, well, briefly, I mean, we could dive into numerous aspects of my childhood, but what I would say briefly is that I had, I think, best stated as a nomadic childhood. Although I was born in San Diego, California, I moved over 50 times before entering the foster care system.
50 times?
Yeah,
50.
Attending over 35 schools throughout the country. So,
oh my.
I think that's best summarized by a nomadic childhood.
Yes, right.
And in that time, we were homeless, often seen as motel families or living out of our cars or squatting in various friends' houses and couch surfing, things like that, plagued by family members who suffered from severe addictions and mental health issues that were, of course, their mental health issues complicated by addiction and vice versa. And then finally, right before I turned 13, the summer before I turned 13, I self-reported myself to foster care. At that time, we had made our way across the country from California back to Michigan, where my biological mother is from. And then I found myself in foster care shortly thereafter, and then eventually aged out of foster care at the age of 18, the delightful midnight bell rings, and there you find yourself. So, aged out of foster care, I was lucky enough to have a teacher who took some interest in me in high school because I aged out halfway through my senior year of high school and was really just trying to figure out a way to stay in high school. With the help of a teacher, I ended up applying for college and getting into Michigan State, her alma mater.
Wow.
Green,
yes.
right?
Yep, go green. Go green.
And, I think that was supposed to be the happily ever after, right? Like, yes, you've suffered this trauma and this turmoil, but we got you into college, and now you're 18 and adult, and good luck to you. And that really became a difficult transition for me. I would not say I was an exceptional student. My first year at MSU, I was dealing with quite a bit of things, attempted suicide for the first time, was really depressed and withdrawn from everything that was happening around me. And playing into that was financial need. I didn't have enough money for basic things that I needed in college, hygiene products, etc., and so had to get a job and ended up getting hired part-time as a receptionist in a law office at minimum wage, and enjoyed that job. Maybe not the firm I started with, but I enjoyed the work and eventually sort of worked my way up into being a law office administrator. Hired a law clerk who eventually became my husband, and we moved to Traverse City in '99 to start a law office, really with this idea of trying to do it differently than we had seen criminal law being done. And we did criminal law practice in Traverse City. My husband's still a practicing criminal defense attorney. And in that process, I started to realize that our clients' issues weren't merely whatever the crime that brought them to us was. And it got revealed that a lot of our clients had spent time in foster care, had these tumultuous backgrounds in childhood. And at that time, I really hadn't disclosed my time in the foster care system. It wasn't something that I openly talked about. Very few people knew about it. And I just sort of started Googling, foster care statistics, trying to understand what was going on with our clients, and really became floored by the statistic that approximately 70% of incarcerated inmates had spent time in the child welfare system at some point in their childhood. And that really got me thinking sort of about root cause and those things. And so I made it my mission to sort of let out this secret that I had. I wrote the book Garbage Bag Suitcase with the hope that we could really reinvent child welfare and get to some root cause issues and look at how do we heal trauma in order to help people make better decisions.
Great. And so we're talking with Shenandoah Chefalo, as she mentioned, the author of Garbage Bag Suitcase. And I have that book in my hand, which I find fascinating. And can you tell our listeners a little bit about the book, that if they read that or if they start skimming it, what are some of the things you in particular want them to make sure they find? You know, one of the things I found fascinating when I was reading through it was your observation of making some decisions about people based on their groceries in the grocery store. And I just found all of these things so fascinating. And I know that with our limited time, you can't talk too much about the book, but maybe there's a couple things you want to make sure people know about it, and it might get them to go online and buy it.
Yeah, well, with regards to the grocery cart, all of these things, all of the stories that I try to tell in the book really are to get people interested in understanding one basic thing, and that is, why do people do the things they do?
Right.
Whether we see somebody in a store who seems to be yelling and screaming for what we would say is no reason, or, you know, we see a news article about someone, you know, maybe a mom who got caught drunk driving with her children in the car, and we see the comments, or we make comments to ourselves about why would somebody do that. Really, for me, it's about having a different conversation, which is what's happened to that person to bring them to this point, and understanding that most all of us have a story to tell, and that story affects the way in which we see the entire world. And especially for people who have lived through severe trauma or severe adversity, sometimes we see the world in what might be considered a chaotic way, in which we're always looking to protect ourselves from the next thing. And so all of these stories that I share in the book are really trying to get us to that point and to say, and what do we do about it? And for me, the purpose of sharing my story, because I'd done a good job at keeping it a secret for a really long time,
right.
But the purpose for me to share the story was to get people past the story and almost to the second half of the book, where we can talk about solutions in which we can address this in our communities.
Yeah, it's a great read, so I highly recommend it. And so one of the things we're now at the foundation very involved in our behavioral and mental health focus area are, and I think you alluded to what we are calling the social determinants of health, and why people are the way they are. And so I know this topic is also about root cause of sort of the same thing in these social determinants of health. And another new term that I hear all the time is resiliency. In fact,
right.
I read an article in the Wall Street Journal a couple days ago regarding the Generation Z and their lack of resiliency as it relates to almost everything they do. And so I know you're a faculty at the Center for the Trauma Resilient Communities, and can you talk a little bit about the center and this resiliency factor?
Yeah, so the center started because a bunch of people who were really involved in trauma-informed implementation theory were interested in realizing that reaches beyond the walls of foster care or child welfare, and that really you need whole communities who, yes, understand the trauma piece, but more importantly, because the trauma piece can be really depressing to talk about and you can get stuck in that circle for a long time, is so what do we do about it? Why is it that some people, like myself, go against all statistics and all odds and seem to have great resiliency or great bounce back, and other people don't? And so looking at things like the Harvard study on resilience and those pieces, helping communities understand how they play together, and that there are some pretty core things we can do to help people retrain their brain, if you will, so that they can bounce back better, right? And,
yes, exactly.
And a lot of those things are based in connections and communities, and that's why they're so important.
Yeah,
so the center is focused on training and helping communities develop models that work in their specific groups.
Sounds terrific. And so what will be your general message there so we can entice people listening to this interview to come out on May 14th?
The general mission is, for me, is going to be real simple. Let's focus on solutions and how we move this conversation forward, and what action steps can every single person take to do that, because I believe there's something for everybody to do in this conversation.
Great. Appreciate it very much, Shenandoah.
Thank you so much, Larry.
All right. Safe travels. That was Shenandoah Chefalo. She's author of Garbage Bag Suitcase and faculty at the Center for Trauma Resilient Communities, here on the great voice of the Great Lakes, News Talk 760 WJR.
It's Caring for Kids with Larry Burns.
Dr. Elizabeth Kaufman is a program director of the Trails program at the University of Michigan. Dr. Koshmann oversees the delivery of clinical trainings for community mental health clinicians and school professionals, design, development, and production of clinical and training materials, among an array of other things. Her clinical expertise is in the treatment of emotional and behavioral health conditions in youth using evidence-based cognitive behavioral approaches. She has her BA in psychology from Wesleyan University and a PhD in psychology from the University of Wisconsin at Madison. Dr. Koshmann, welcome to Caring for Kids.
Good morning. Thanks for having me.
We're delighted to have you. And for those of our listeners that are not familiar with what we're referring as TRAILS, tell us a little bit about the acronym, what it stands for, the department at the University of Michigan, and sort of get us started on what this is all about.
So TRAILS is an acronym that stands for Transforming Research into Action to Improve the Lives of Students. And the acronym was developed actually after we had started our partnership with a number of high schools in Washtenaw County. And those high schools had come to the Depression Center at the University of Michigan to request our help and support after they had experienced a particularly difficult year in about 2012, when they were just feeling an overwhelming need of students that were experiencing depression, anxiety, and the impact of exposure to traumatic events in their lives. And the school staff just felt that they really were not able to respond to the needs of their students, both due to the complexity of the needs the kids were experiencing and the volume of kids presenting with significant difficulty, sort of being in school, being present, staying engaged, and staying safe.
And so your role as program director of Trails, what exactly are you doing for the program as it evolves?
Well, in the very beginning, I did everything. It was myself, a faculty mentor, Dr. Kate Fitzgerald, a colleague, Dr. Jim Abelson. Both of those were senior faculty who were supporting my career development and encouraged the start of this program, and a work-study student who was an undergrad double major in psychology and statistics. And mostly it was the work-study student and myself thinking about what was our goal, what was our mission, and I would go out and deliver trainings to our school partners, and then I would assist those school partners with delivering skills grounded in evidence-based practice to their students experiencing symptoms of mental illness. And the work-study student would help me enter data and collect data to sort of monitor and evaluate the impact of our partnership with the schools. Since that time, our team has grown to about 40 faculty and staff. Oh. So my role is to help guide the vision and direction of the TRAILS program, make sure that any of the work that we're doing with our community partners is grounded in empirically based treatments and supports for kids impacted by mental illness. I think about sustainability and sort of strategic growth to make sure that we don't grow too fast, too quickly, and to make sure that all of the work we're doing is really responsive to what our community partners need. We don't want to grow in a direction that's beneficial to a research mission unless that research mission is responding to what we hear from our partners as a needed support and needed help.
Excellent. A great partnership indeed. And we're talking with Dr. Elizabeth Kaufman, who's a program director for TRAILS, a program out of the University of Michigan. And we mentioned earlier on about cognitive behavioral therapy and why it's so effective for treating mental illness. Can you talk a little bit more about what that exactly means?
Sure. So when we work with our schools, we're really aware that school administrators, principals, and superintendents don't want to be in the business of providing therapy to kids. That's the job of outpatient mental health providers, psychologists, community-based clinics. But cognitive behavioral therapy, even though it has the word therapy in it, is really a set of skills. And when we look at what causes kids difficulty, it's not the way they think and it's not the way they feel, it is their behavior. So kids get in trouble when they're impulsive, when they're reactionary, or when they're just really shut down and their mood causes them to stay in bed, to not be able to get to school, to not be able to engage in the classroom, or to not be able to interact with their peers in a way that's developmentally appropriate. And CBT, cognitive behavioral therapy, is a set of skills that has kids slow down and examine their cognitions or thinking, their feelings, and their behaviors, and the relationship between those three components, so that a kid can notice when their thinking is maybe irrational or illogical or hopeless or helpless, and then they can use some of the skills to interrupt that thinking or those thinking patterns and link that new, improved thinking to better behavioral decisions and to feeling better emotionally. So CBT doesn't have to look like therapy the way we picture a psychologist sitting back in their chair sort of pondering how their patient is doing. CBT is really just a set of effective strategies for dealing with everyday stressors and challenges and difficult situations. But it also is grounded in really the best research that has examined what is impactful for kids who are experiencing true mental illness like depression, anxiety, or post-traumatic stress disorder.
Great explanation. And so the Trails program is school-based, as you explained, and why being located inside the schools, why is that so important as it relates to being outside of the classroom or outside of school? And then sort of a follow-up question with that. Within the schools and within the program, what kind of trends are you seeing with young people? And we read a lot about new mental health behavioral issues evolving in early childhood, and are there certain trends that our listeners want to hear about?
Yeah, so if you're a parent and you've experienced having a child that is struggling with everyday stress and pressure or with a more significant mental illness, you are probably already very familiar with the many, many barriers to getting high-quality care. So even as a faculty member in the Department of Psychiatry, I often struggle to help make a referral to an outpatient clinician or a therapist or a service in the community that a family can access due to challenges of either a long wait list or an insurance barrier where insurance won't cover the service. And many people can't afford the very high out-of-pocket expense of outpatient therapy. And also there's a huge social stigma among a lot of different parts of our population that prevent many people from seeking help at a clinic. And yet we have kids that are showing up every day at school, walking into the office of their school social worker, psychologist, nurse, or sometimes just their school counselor, and bringing those challenges that are related to their emotional well-being to those school professionals. So Trails is really designed to improve access to high-quality care. We want to train the people that kids access already in the practices that we know will help them. So that's why we picked the school setting.
Yeah, that makes perfect sense. And as our foundation gets more and more involved in mental health programs, it clearly we see that there's a lack of not only professionals for people to see, but the waiting time and the insurance issues are a big problem that hopefully over time we can help solve. And so tell our audience, you mentioned about the partnerships, and we're a partner at the Children's Foundation, and talk a little bit about what that partnership is and maybe mention a few other partners as it relates to advancing the mission of Trails.
Sure. Well, we are so incredibly grateful for the support that we get from many foundations across Michigan, but certainly the Children's Foundation has been a significant partner. We were really fortunate to partner with the Ethel and James Flynn Foundation, and we have a close partnership with Andrea Cole, who helps lead that organization. And her organization, the Flynn Foundation, has already supported a pilot project here in Washtenaw County where we work to embed the Trails program as well as two of our partner programs that provide stigma reduction and education and awareness programming, as well as suicide risk identification and reduction programming in our middle schools. So the Flynn Foundation, in our middle and high schools, I should say. So the Flynn Foundation has supported that pilot work in Washtenaw County, and after a year of really successfully partnering with our local school district, the Flynn Foundation offered to be a champion of a number of organizations and foundations in Southeast Michigan to help us connect with and partner with the Detroit Public Schools Community District. So the Children's Foundation helped us connect with that district, and now we are in our first year of outlining a partnership where over the next couple of years we hope to assist that district in thinking about what is the state of behavioral health care programming for their students, who are the partners at the table, so local behavioral health care providers. For example, the Detroit Wayne Mental Health Authority oversees a lot of delivery of behavioral health care services in the city. And we want to look at what programs are serving those kids, where are there gaps in services, and how can Trails help to design a full array of services from kindergarten through 12th grade that would help their students arrive at school emotionally and behaviorally ready to benefit from their academic program.
Great. Well, we also partner with Andrea and the Flynn Foundation, and I believe she was the individual who introduced us to the Trails program, and we're delighted about that. So we'll keep in touch, and we'll have you back as the Trails program progresses, so our listeners can find out the great work that you continue to do. So, Dr. Koshmann, I want to thank you very much for being on Caring for Kids, right here on the great voice of the Great Lakes, News Talk 760 WJR.
It's Caring for Kids with Larry Burns.
Well, thanks for joining us tonight on Caring for Kids, our special episode featuring some wonderful guests from past episodes. I also mentioned last month that we, the Children's Foundation, created an emergency fund to help our partners deal with the COVID-19 crisis. I'm pleased to announce that over the last month or so, we've distributed over $250,000 to our partners, as well as we have established new partnerships in the community. I also am very pleased to announce we've been able to raise additional funds to allow us to continue this effort in our emergency fund. So wait for some announcements in the near future regarding that. And I have to thank some of our trustees, our donors in the community, iHeartRadio, and many others who have helped us during this crisis. Also, I'm very pleased to announce that our spring grant cycle is well underway, and we'll be announcing our new grants in early June that will add our partners in the community across the state, as well as in southeastern Michigan. So we continue to be a foundation on the move. Thanks for joining us tonight on Caring for Kids, and thank you for your continued support. Be safe, stay healthy, and as I like to say, onward.
Caring for Kids with Larry Burns on WJR has been presented by the Children's Foundation.